Hi, I'm Amanda Rowan, founder and head coach at the Therapist Development Center. If you're a first-time viewer and looking to pass your social work or MFT licensing exam, or just interested in topics relevant to clinical social work and psychotherapy, you've come to the right place. If you like it, be sure to subscribe for updates. You can also sign up for our complete LMSW, LCSW, and MFT exam prep programs by going to our website at therapistdevelopmentcenter.com or clicking on our logo. Thanks. Today's topic: free MFT exam practice question, depressive and bipolar related disorders. This week, our free MFT clinical exam practice question is going to focus on the topic of depressive and bipolar related disorders. Most of us have worked with individuals who have been diagnosed with some form of these DSM diagnoses, which will be extremely helpful during the exam. Yet, not everyone has witnessed or experienced working with clients exhibiting symptoms associated with the diagnoses of bipolar 1 or bipolar 2. Regardless of how much or how little you already know about the subject, the Therapist Development Center's exam prep will ensure you know everything you need to correctly answer questions on this topic. How might this topic be tested? Whether you are taking the California MFT Clinical Exam or the National MFT Exam, there are several ways in which depressive and bipolar-related disorders might be tested. Questions on either exam could test your ability to diagnose these disorders, differentiate these diagnoses from each other, develop an appropriate treatment plan, know expression of diagnoses across the lifespan, be familiar with various medications used to treat these disorders, and be aware of proper referrals and coordination of care. Let's see how you do on this week's free MFT clinical practice question. Practice question on depressive bipolar-related disorders. A 62-year-old female comes to therapy for treatment of depression. She is recently separated from her partner of 16 years and was also subjected to a recent layoff at work. She reports that she is struggling with ageism and is unable to find employment, has a hard time getting out of bed, and doesn't see the light at the end of the tunnel. In addition, she states that the only solace she finds is at the bottom of a bottle, that she stopped attending bocce tournaments she used to play. What interventions should the therapist consider in this case? A. Identify social supports available to the client. Inquire about frequency and intensity of her alcohol consumption. Refer the client to a psychiatrist for a medication evaluation. B. Identify social supports available to client. Inquire about the frequency and intensity of her alcohol consumption. Evaluate level of suicide risk. C. Suggest the client exercise on a regular basis. Refer the client to join the group of recently single individuals. Evaluate level of suicide risk. D. Suggest the client exercise on a regular basis. Refer the client to join the group of recently single individuals. Refer the client to a psychiatrist for medication evaluation. The correct answer is B. Based on the information presented, it is evident that the client is struggling with depression and hopelessness. In addition, her recent history of loss and substance use all put her at a high level of risk for suicide. Thus, we must assess for suicide in our answer. The only two answers that contain that option are B and C. Thus, answers A and D are automatically going to be ruled out. Answer C has the therapist providing very good referrals. However, it ignores a pretty important element that we have to attend to, and that is alcohol use. The referrals and recommendations mentioned in C might come later, but they are not as imminent as doing a substance use evaluation. Thus, C can also be ruled out, leaving us with the best possible answer, B. To learn all about the intricacies of depressive and bipolar disorders, sign up for one of TDC's MFT exam study guides to help you prepare for your exam today. Thank you so much for listening. Remember, if you're studying for your exam and looking for the best LMSW, LCSW, or MFT exam prep, please visit our website at therapistdevelopmentcenter.com to sign up. With a 95% pass rate, we offer the best study system on the market to help you pass your exam with confidence. Here at TDC, we're with you until you pass.